Another route of drug administration is the systemic route, and drug administered through systemic route is desired to enter into the blood circulation and distribute to the entire body and produce a systemic effect, unlike the drug given by the local route of drug administration. So it is further classified into the enteral route and parenteral route. So enteral route, from the word, it is derived from the word intran, which means intestine. So this describes when the drug is administered into the gastrointestinal tract, specifically from mouth to rectum. So this enteral route is further classified into oral route of drug administration. Secondly, sublingual route of drug administration. And third, buccal route of drug administration. And fourth, the rectal route of drug administration. So different dosage form like the tablet, capsules, syrup, suspensions, these are administered by the oral route, and it is the most convenient route of drug administration. Sublingual route, it is limited to the few medication, just like the glyceryl trinitrate or nitroglycerin, which is administered beneath the tongue, and from where it is absorbed into the superior vena cava. The buccal route, from the words bocca, which means cheek. So this describes when the drug is placed between the gums and cheek, and this include different medication like the anti-seizure medication, and also the hormone therapy are administered through this route, and from here it is absorbed into the superior vena cava. Rectal route, as we described in a local route, it is also used for the local effect. In this case, the drug is given like corticosteroid. So it is used for systemic effect, and the drug in this case are indomethacin. Rectal route is used when the drug induce vomiting if it is given by the oral route, and it is used for the anti-emetic medication. So drug in the solid form, they are administered through rectal route, and they are called suppository, and the liquid drug administration through rectal route, that is called enema. So rectal route has a bivascular system. One system delivers the drug from the rectum into the inferior vena cava, and the other system delivers the drug from the rectum into the liver. Before the introduction of the IV route, rectal route was mainly used for introducing a morphine drips, in which is the administration of the large volume of the fluid in the form of infusion, drop by drop through the rectal route. It was introduced by the American surgeon Benjamin Morphy. Systemic route, that is parenteral. The word parenteral means without the gastrointestinal tract. So this means that the drug bypasses the entire digestive tract, the enteral route, and practically the word parenteral is synonymously used for injection, but parenteral route is classified both into the injectable form of the drug, that is injections, and the other, the non-injectable route. So parenteral administration is done when the drug is not absorbed from the oral route, or when the drug is destroyed in the gastrointestinal tract, or when the patient is unconscious, or when a rapid action is desired. So depending upon the nature of the drug and the desirability of the action, the parenteral route, specifically the injectable, using different injection technique, medicines are administered majorly through four different techniques. The first one is intramuscular route. So intramuscular route, this is the muscular layer, and injection is administered into the muscular layer. From here it is absorbed into the systemic circulation. Different drugs are administered, and some other depot preparations are also administered, which are the suspension of the non-aqueous vehicle along with drug, for example polyethylene glycol. So this non-aqueous vehicle diffuses out of these muscles, and the drug becomes precipitated and it produces a sustained effect. For example, the long-acting injectables, that is haloperidol, antipsychotic medicine, which provides a therapeutic effect from 2 to 4 weeks, and also the medroxyprogesterone, which is also a depot preparation, or it is a birth control, it is a contraceptive which has its effect for up to 3 months. So another another injection technique, that is the subcutaneous. So subcutaneous drug administered in the subcutaneous layer, the most familiar drug, that is insulin, is injected subcutaneously, and also some others just like the lidocaine and epinephrine. A minute amount of epinephrine is injected. So it is this route is used for the subcutaneous, and other the etonogestrel is also implanted in the subcutaneous layer. Another injection is made in the dermal layer, so that is intradermal injection, and majorly this route is used for the allergy testing, or in the Montauk's test, in which the tuberculin is injected in a small amount. And another example of the intradermal administration is, it is also done for the BCG vaccination against the TB. Another route is intravenous route, in which the drug is administered directly in the vein. So this is mainly done 25 angle and intramuscular 90 angle. Subcutaneous administration is done both at 45 and 90 angle, and intradermal administration is done through from 10 to 25 angle. Another injectable, that is intraperitoneal route, in which the drug is administered in the peritoneal cavity, and also intraosseous injection, when injection is made with the help of bone injection gun into the bone. So another injectable, that is intracardiac injectable, intracardiac route, in which the stimulant epinephrine is injected in case of cardiac arrest. The non-injectable parenteral route include the transdermal route of drug administration, mainly with the help of transdermal patch. It is a medicated patch which is applied on the surface of the skin, and the active ingredient, the drug present in this patch, moves across the skin for the systemic effect. So different patch medication, they are sticky patch, they are applied, for example nicotinic patch, they are applied for the cessation of smoking. Similarly nitroglycerin patch, they are applied in chest pain, in angina pectoris, and also the birth control patch, they are applied in birth control. It releases the estrogen and progesterone. Similarly fentanyl patch are applied to relieve the pain, and antiemetic patch, they are scopolamine patch, they are applied, and which inhibit the vomiting. Another subclass is the parenteral route is inhalational route, and this include the nasal inhalational route and oral inhalational route. So this route delivers the drug directly to the respiratory mucosa, and this route is mainly effective for the patient having respiratory complaint like chronic obstructive pulmonary disease and asthma. So among the nasal route, drug administration by nasal route, this include the diabetes insipidus treatment, desmopressin, which is administered for the treatment of diabetes insipidus, is administered through the nasal inhalation. And similarly, the Salman calcitonin in the treatment of osteoporosis in postmenopausal women is administered through nasal inhalation. And oral inhalation in asthma, the drug bronchodilator like the albuterol, it is administered by the inhalational route, oral inhalational route, and some corticosteroid or inhaled corticosteroid like fluticasone, it is also administered through these oral inhalational route. So different devices like the metered dose inhaler, it is used to administer the drug through oral inhalation. Out of all these route of drug administration, no single route of drug administration is ideal for all the drugs in all the circumstances. So therefore, selection of the route of drug administration is made based on the drug related factor, the physical nature of the drug and chemical nature of the drug, and also the patient related factor and the therapeutic desire.